Our next guest is joining us this morning to talk about a serious complication that can come from heart disease. It's called Peripheral Artery Disease, or PAD. And while it can be serious, there are ways to treat it. Here with more is Dr. Michael Gaglia from the Cardiovascular Institute of the South. Welcome back, doctor.
Good to see you.
Thank you so much for joining us this morning. I loved our conversation on heart disease, and now we're talking about peripheral artery disease. Please explain what that is for those of us who do not know.
Sure. So the simple explanation is the pipes that supply blood to the lower extremities become blocked with cholesterol plaque, just like the pipes that supply blood to the heart become blocked with cholesterol plaque.
Very interesting. We have a visual we want to show you all right here of how it happens. And it's interesting because this is often unrecognized and undiagnosed, which is why I'm glad we're having this conversation this morning. What are some of the symptoms of PAD?
So the textbook symptom that people have is something called claudication, and that's just a way of describing a symptom that is cramping pain in the lower extremities with exertion that gets better with rest. The interesting thing is that just like the heart, not everybody reads the textbook. And so some patients will have not cramping, but just vague discomfort, leg numbness or weakness, intermittent coldness of the lower leg, or even hair loss and shiny skin. Now, it's a continuum, of course, and everything usually starts with the claudication, meaning cramping pain in either the calves, the thighs, or the hips with exertion that gets better with rest. But as things progress, as you might imagine, you might have symptoms with lower level activity. And in a significant minority of patients that are especially high risk, they can have symptoms at rest.
And I'm very interested, doctor, when we're talking about this condition, who is most at risk for this?
So the biggest thing that we spend our time on and the most significant risk factor we see is, of course, smoking. Your risk increases significantly with continued tobacco abuse. The other risk factor, though, that's probably underappreciated is age, and your risk of having PAD independent of smoking increases dramatically with age. And then I'd say the third thing that we see most commonly is folks with diabetes, especially uncontrolled diabetes, are at significant risk of PAD.
Very interesting. Now, I'm wondering, for people who may be watching this right now saying, okay, I have these symptoms, I need to go and see if I get diagnosed with PAD. How is it diagnosed?
So we usually start with something incredibly simple, which is something called an ankle brachial index, which compares the blood pressure in the ankle as opposed to the arm. And if that ratio is decreased significantly, then that can imply PAD. And that's an incredibly powerful predictor of future risk. If your ABI is abnormal, you're at risk of a whole lot of bad things, both with your legs and also your heart. But sometimes we'll move on to doing a more detailed ultrasound study of the lower extremities to look at the blood flow and where the plaque might be. Sometimes we'll do CT scans to look at the same thing, but get more anatomical information. And then sort of the last step that we usually take is to do an angiogram where we inject dye into the arteries directly to see where the blockages are.
Really interesting. And I think it's important that people know if you are experiencing these symptoms, go and get diagnosed, because once you're diagnosed, you can then get treated, because this is something that is treatable. How is it treated?
So the first thing we usually recommend is an exercise program, and patients can have dramatic benefit just from exercising more. And they may not have complete relief of their symptoms, but they'll be able to exercise longer distances and walk longer distances before they would get the claudication, the cramping pain. Just like the heart, medication is incredibly important. And we know that treating cholesterol, getting folks to quit smoking, treating diabetes, treating high blood pressure, and then in some instances, medication for the pain itself. There's an antiplatelet medication called cilostazol. These are all useful strategies to treat people with claudication.
And question for you, doctor, if PAD is left untreated, what happens then?
So if we can get people on good medicine and an exercise program, a lot of times that's enough, especially if we can get folks to quit smoking. But if things progress, typically it ends in a procedure where we try to open up the narrowed or blocked arteries in the lower extremities in the legs. When we think about the technology that's available now to us as interventional cardiologists, there are a lot of different options now that weren't available, say, 10 years ago, for us to open up the blood flow and improve people's symptoms in regards to PAD.
And
But
when
you
it comes to
mentioned
people who are
severe progression of disease. What happens if you don't treat it? In a minority of patients, it can progress to the point where they're at risk of limb loss or amputation.
And here in Louisiana, that's actually a problem, right? A lot, because listen to this statistic, everyone. 60% of amputation procedures performed in the United States could have been prevented. But we also have a problem with that here in Louisiana, right?
That's correct. And it's not something that I'm particularly proud of, but Louisiana has a very high amputation rate. And our mantra is that no one should have a non-traumatic amputation unless they have an angiogram looking at their arteries first.
Some great advice this morning. Doctor, thank you so much for joining us as always. And hey, for more information about heart health, you can log on to cardio.com. You can also contact the Cardiovascular Institute of the South by giving them a call at 504-354-5252. They are located at 1901 Manhattan Boulevard, Building A, Suite 200 in Harvey.